question by going to our website, allhealthtv.com. So easy. Or just give us a call. Toll-free number, 855-796-4475. And gentlemen, speaking of call, we have Rudy from Sunrise who has a question for, I believe, Dr. Shaliff. Hi, Rudy.
Hi there. Good morning.
Good morning. Thanks for calling into Smart Life. What's your question, dear?
I need to ask doctor my best way of getting control over my cardiovascular disease, which is extensive, in reference to my HDL, LDL, and etc. I'm presently taking medication for it, but I wonder if there's other things that I can do to raise my HDL, lower my LDL.
Great question, and we always want to raise that HDL.
Yes, and I get this question very frequently. First you need to do is optimize your risk factor, your lifestyle modifications. Is he exercising? Is he having the diet? Is he eating the right amount of fiber for the day?
Right.
And we have goals for that.
And all that will make a difference with the cholesterol, correct, doctor?
Yes, because what that will do is if he meets those goals, theoretically we can actually use less statins, for example, to get to that therapy.
All right. And how important is it to get those numbers in order?
Very important, because we look at numbers needed to treat and how to save lives. And getting to those numbers will save lives.
Great. All right. We got Maria now from Miami, and she has a question for you, Jerome. Hi, Maria.
Hi. Hi, Jerome.
Hello.
Thanks for calling in, sweetheart. What's your question?
My question is, I'm 54 years old, and I've been yo-yo dieting my whole entire life.
Oh, I love that.
I probably have...
Yo-yo dieting.
Yo-yo dieting. Yeah. And I probably have about 25 pounds to lose. I'm looking at diets, and I don't find anything that's sustainable, the keto diet and this and that. It just seems like it'll clog up my arteries. Is there something that I can do? I also have a thyroid issue, which makes it a little bit harder for me.
Okay, great question. Jerome?
Well, what I teach most of my clients is I think the key is potassium, but not through bananas because the sugar will increase and we don't want to add any fat. I think potassium from kale would be one of the best things a person can put in their body. Potassium helps lower blood sugar. Right. It helps regulate it. So if she wants to, okay, and another thing potassium does is it also removes sugar from the brain. So it stops a person from craving.
All right.
Cravings come from the hypothalamus. So when a person craves too much, it shows that they're not having enough potassium in the body.
Look at that. I didn't even know that. And yes. Dr. Shaliff, would you like to chime in and maybe give Maria a thought or two?
Sure, and I think the yo-yo diet is very typical of what we hear all the time, which is really describes it very well. The thing is this, if she has a medical problem, the thyroid, that needs to be addressed and put on maintained under control. It's hard to lose weight if, let's say, your thyroid is underactive. Is she taking medications that can affect her metabolism that'll also prevent her from losing weight? And then you have to be realistic about your diet. These fad diets are not sustainable. It's maybe for a short time you lose weight, but you'll bounce right back.
As soon as you start just eating normal again, right?
Exactly, or your bad habits.
All right, thank you, gentlemen. All right, Maria, thank you so much for calling into Smart Life. We have an email now from Nancy, and she's from Miami, and here's what she writes. Gentlemen, what is the most natural way I could reduce my cholesterol with medication? And is oatmeal, I love this question, is oatmeal in the morning a good start? Dr. Shaliff, I'm going to start with you.
This is also,
and again, without medication.
Yes, without medication. Oatmeal is excellent. It is a fiber, and it does help reduce cholesterol when taken in the proper amounts. We strive to read a certain amount of fiber in your diet. It's about 25 grams for women, about 38 grams for men a day. Now, the average person, believe it or not, eats about 15 grams of fiber a day. So they do have a little ways to go.
All right, and Jerome, your thoughts on oatmeal?
Oatmeal, I'm not too much of a fan. My clients that's dropping 35 pounds in 4 weeks, I tell them to stay away from carbs because we don't want to spike insulin. When we spike insulin, we can't burn fat. So I'm not a huge fan. Yes, it does help with cholesterol, but it's not my go-to.
Okay, very good. All right, let's go to now Abby, who's called in, and she has a question for you, gentlemen. Hi, Abby.
Hi.
Thanks for calling in.
Thank you.
What's your question, dear?
My question is, what is the best natural treatment for cholesterol?
Great question, Dr. Shaliff. Obviously, that's good for you.
Yeah. And what we do is, again, after you do your lifestyle modifications, we look at phytosterols, Prexator. which helps block fat absorption in your intestines. That we find to be the most effective when taken in the proper amounts, has been shown may reduce cardiovascular disease moving forward.
Which is very important to do. All right. Abby, thank you so much for calling in. Jerome, I also wanted to talk to you about that yo-yo diet. You have a lot of patients or a lot of clients that come in and say, you know, I've tried this, and sometimes when they start eating normal again, they gain the weight. What is your advice to them? Because people get frustrated, they give up, and they just don't feel like persevering anymore.
Well, the thing is, I think people focus on calories, and calories doesn't cause sickness.
Good point.
It's sugar. So again, I tell people that I'm not a doctor, so I give them the disclaimer, but I did drop 60 pounds in 4 months. I do have clients that's dropping 50 pounds in 9 weeks.
Wow.
And the focus is not exercise. The focus is changing what you eat. Like the doctor said.
The lifestyle.
The lifestyle change. You have to. Once you change the way you eat, you change the way you live.
And doctor, I always say to viewers and everybody that I adore next to me who wants to lose weight, consult with your doctor first.
Absolutely.
You always have to do that first.
Now, he does bring up a good point, is that sugar, you don't want those spikes because it changes your insulin levels, and that is actually the big problem. So you hear the story, take small meals throughout the day so you don't get that insulin spike. And that's when you run into trouble, is that spiking of insulin, which is catabolic, and there's, of course, is anabolic, it builds in this case. And that is what you're working against.
Fantastic. Gentlemen, thank you so much. Great segment, great questions from our viewers, and that's how it's done. You call in, you email, and we get the answers from our experts. Gentlemen, again, thank you.
Thank you.